Obesity. Who's too chubby? Are you one of the 72.2% of American adults who is overweight or obese? I don't know. If you don't know, check your BMI. We've got a calculator here, handy dandy. You just plug in your weight and your height, and normal is 18.5 to 24.9. That's ideal body mass index. You're overweight if you're 25 to 29.9, obese if you're over 30, and morbidly obese if you're over, did I say that wrong? Obese if you're over 30 and morbidly obese if you're over 40. Who cares? Well, this isn't anything about body shaming, okay? This is about optimizing health and minimizing cancer risk. And it turns out that fat, adipose, has a host of properties that elevate your risk of getting cancer, of having it recur, and of dying from it in an undeniable way. So we've talked about how 80% of breast cancers are fueled by estrogen. High estrogen levels after menopause increase breast cancer risk. Remember, fat converts the steroids to estrogen, thanks aromatase. So the big question is, do obese women have increased estrogen levels that increase their risk of breast cancer? To study that, you have to look at women and weight who are not taking hormone replacement therapy, who went through menopause. And the spoiler alert here is that the more weight you gain, the more risk you have. The more weight gained since age 18, the more postmenopausal breast cancer risk you have. Fat tends to be breast cancer protective before menopause. Poorly understood reasons why. But you're unlikely to be obese until menopause. And then, as we all know, metabolism slows down. It just becomes really sticky trying to lose an obese amount of weight to normal body weight after menopause. So best to just try to target ideal body weight and maintain it your whole life. If you gain 8 to 14 pounds after high school, 25% increase in breast cancer risk. 14 to 29 pounds increase, 60% increase in risk. And you basically double your risk of getting breast cancer if you have gained more than 29 pounds since high school. As I was saying, there's no controversy in the literature, 50 to 250% more breast cancer, recurrence, and death in obese versus non-obese women. And it has a lot more to do with in inflammation than it does with actual estrogen production, it turns out. And this is just getting uncovered in the literature. 2020, 22, 2019, recent studies showing that, yeah, you've got the estrogen production via aromatase, that's definitely bad, but leptin and leptin receptor expression, it's so interesting. Leptin is produced and secreted almost entirely into the circulation by adipose tissue. So once leptin binds to its receptor, it crosstalks with multiple oncogenes, which then ignite a series of like, turn this on, turn that off. And all of the ons and offs that it does are always the signaling pathways that are pro-inflammatory, releasing cytokines and growth factors. And the end game is breast cancer, initiation, progression, and metastases. The third thing fat does is it generates chronic inflammation. So this adipose-derived activated macrophages produce, again, pro-inflammatory mediators, interleukin-6 and 1 and tumor necrosis factor alpha. And so chronic inflammation is promoting this cancer growth and metastatic spread. And angiogenesis, it also allows for the blood flow. But here's the thing, it modifies the immune responses and it interferes, get this is kind of new, interesting. This is the 22 study that I read. It interferes with hormonal and chemotherapeutic treatments. And maybe that in part is why we have elevated mortality in overweight and obese breast cancer patients, because the therapies we employ to help stave off said recurrence and death are less effective because of this adipose chronic inflammation. And finally, insulin and IGF-1 signaling. BMI correlates directly with circulating insulin. Insulin activates aromatase, there she is again, and it directly stimulates the growth and invasion of breast cancer cells. It also decreases IGF-1 binding protein, so now you have more IGF-1. It stops apoptosis. Hey, cancer, don't die, hang out, we like you. No, we don't, but that's what insulin is saying. And it elevates VEGF, so angiogenesis occurs. Here's the good news. You lose the weight, you lose the risk. 64% decrease in breast cancer, for premenopausal weight loss, 52% for postmenopausal weight loss, 34% for just hanging tight with the same weight before and after menopause. Gaining more than 5% of your initial weight during or after treatment, irrespective of baseline BMI, increases the risk of recurrence and reduces survival 5-fold. That's 400%.